All right, we're back. We've got about 8 to 10 minutes, so I'm going to let Dick do his part. Dick Wood, Certified Choices Counselor, and then Dawn's going to wrap up what is extra help, and then I'll finish at the end.
All right, I'm going to give you that phone number once more, 203-757-5449. That's our agency number. And if you have a question about anything, and if anyone out there thinks they've been treated badly, dollar-wise or something like that, the question of fraud might come up, you can give us a call. We have a specialist in the house that takes care of that, and we'll certainly follow it up. What I'd like everyone to do also to recognize that time does move on, and in a few months our re-enrollment comes up. So you want to stay on top of that. Don't wait until October 15th to call us, because sometimes we might have things that you have to do to get us information to help you. All right, Dawn, you have a few things you want to bring up?
Yes, I would like to mention Medicare's preventive benefits. There is an annual wellness visit out there.
So slow. People out there, this is wellness. It must be coded with a V code. V for victory for you. What Dick just touched on was a brilliant comment. He went a little too fast, but there's so much fraud out there. Doctors are not bad people. The offices are not bad people. But if they can bill it without it being a V code, they will get a better, reasonable, and customary rate. So preventative, which has been put into the MIPPA Act, MIPPA II. So the Medicare Improvement Patient and Protection Act states that you as a person are entitled to a mammography, a checkup, for women, pap and pelvic exam, for men, the prostate screening. It's supposed to be preventative, to keep you healthy so that you go to the doctor instead of waiting too long and now you go and it's cancer or it's a heart attack and it's too late. So nice and slowly, this is one of my favorite things. And also, other than the Agency on Aging, I work very closely with the Office of the Healthcare Advocate. Victoria Veltri, Maureen Smith, Darlene West, they're all friends of mine. Whenever we see fraud, especially at the office, we are on it like pit bulls. I can't stand someone trying to take advantage of a senior. It's not fair. They get intimidated. Sooner or later, 2 out of 10 seniors are just going to pay the bill because they don't want their credit hurt. And it's just, it needs to be coded with a V code. V for victory. All right, go ahead. Sorry.
And some of the a new benefit that they have, I believe, that started in November of this year, that seniors can also take is depression screening. And probably many of you out there are saying, I'm not depressed. I'm just a little sad today. Well, they do have this depression screening that you can go to your physician, and he'll ask you a couple of questions. Because a lot of times as you age, you're not feeling like you used to. Myself included, it's happened to me. So you can get an EKG screening, glaucoma test, obesity screening, which is also another new one, prostate screening, HIV screening. So there are many preventative benefits.
I'm trying to close my eyes here and look at the chart. I believe the depression screening states that it must be done at the primary care physician.
Right.
Yeah, so females, yeah, I'm pretty sure on that one, right?
That depression screening is really so important.
It's so important because it leads to worse troubles. If you can nip it in the bud, you remember Colleen O'Neill, who was my guest last week. She was fantastic, a clinical therapist. Mm-hmm. The callers loved her. If it's something that you feel you don't want to do in town, there's no referrals on most of these plans, 90% of them. Find another primary care physician. Go and get a screening. It's preventative. It's proactive. It's better to be proactive than reactive. When you get these screenings, please be smart. Call up your doctor. A good friend of mine last week, I'm in a board meeting with friends of mine. Can't say their names for HIPAA reasons, but they're a long-standing client. They've been with the agency for 20-plus years. The owner's brilliant, great with the numbers. He's in his 70s. So he tells me I've got to have this test. I go, well, did you get it with a V code? He goes, no, I'm sure everything's taken care of. Well, no. Look who's laughing, me. I had to call the facility he was having the test for. I talked to the people who, by the way, listen to the show, so thank you very much for listening. And I said, hi, so-and-so. Is the test coded with a V code? The lovely, intelligent woman said, no, it's coded with the something code. And I said, well, I know the plan that gentleman has. That's going to be a $225 copayment. It's going to be considered one-day surgery. And she said, yes, we're actually requiring the copayment when he comes in. I talked to the gentleman. He says, I've never had history of this. This is the first time ever. My doctor wants me to have it. We called the physician. They said, no problem, Mr. So-and-so. We will call and change the coding. 0 copayment. Not that he doesn't have the $225, but it's not a $5 difference. It's a large amount. So when you have these preventative, you hear me all the time, and my buddy at the Y who stopped me the other day and said, keep up the good work and steer the course. If I'm not talking about it, you're not listening. If Dick's not repeating the phone number, you're not going to call.
And something else on those copays.
Please, talk to me.
Copays are killers. Before you sign a policy, before you do anything in the insurance side of the game, find out what your copays are.
Right.
Copays can destroy your financial plan because, like the gentleman here with the $225 as opposed to 0. Do you have $225 to throw on the floor? No, you don't. All right, so you check your copays. No matter what insurance you're buying, check the copays. Don't let it slide under the rug and say, oh, I know I should have asked that question. Why didn't I talk to Dick?
Right. And if you buy from me, never deal with the insurance agent carrier. You always call Gene, who's smarter than me. Call Angela, who's learning. Call Jasmine. We will get the answer, and then we are held liable. I pride myself on that. If it comes out of me or my staff's mouth, we did our homework. We did our due diligence. If you call up an insurance carrier and you're not a client of mine, you're going to be waiting for a good 10 to 15 minutes. Sometimes you're even going to get the wrong answer. So please, look out for your dollars. Dick, what's the agency on aging phone number?
203-757-5449. Sound like I'm making a bomb drop.
But I would like to leave the audience out there with a message. We would like you to start your savings now. More for you to spend. So please give us a call. This program is wonderful. It's more than saving just the $99 a month from your Social Security. You're going to be saving your costs on your prescriptions. You're going to have your Medicare prescription drug plan paid for. You are not going to have any donut hole or gap to worry about. So once again, start your savings now. More for you to spend.
I always get a question. What is extra help?
What is
People
extra?
ask that all the time.
Low-income subsidy is when you're really in trouble. It's the next step to Title 19 Medicaid.
Which is
it's one step above. It supports you in a dozen different ways. There's like a list of small details in terms of extra help.
Right. Again, this is not welfare. We're not putting you on the streets. We're not taking your home away. All I'm trying to do is save you some money. The concept of the show is 100% educational. It's not meant to be a scam. I'm really, really honored that you listened to me at the picnic at Memorial Stadium, or Municipal Stadium, excuse me. A couple of my friends came up and said, yeah, you do a really good job. And I have to pat myself on the back, but I really can't take credit. It's all about my employees. They are 100% the reason I am starting to do well, because they work hard. They have pride. We believe in Jerry's name. The company's named after my mom, G.S. Regan Associates. I'm not going to sell out. In 2 weeks, we're going to have another guest. I'm working on my Osher Lifelong Learning Institute. I've been asked to teach at UConn, so thank you again to Rita Quinn and Dr. Brian Chapman. I'm honored that you asked me. I'm looking forward to it. I will talk to you in 2 weeks. Thanks so much for listening. Have a great Wednesday. Bye-bye.